It's lovely, everybody. Hey, Tom Britt coming to you, and I'm coming to you live from downtown Fishers, the Nickel Plate District, from the town post offices. We're right here in the Spark apartment building just north of Fort A. Ray in downtown Fishers. And as part of our Fishers Live Friday with the mayor of the great city of Fishers, I have Scott Fadness with me today, and I've got also our Fishers Health Department Public Health Director, Monica Heltz, joining me today. So let me go back to our speaker view. Monica, let me make sure I get you up here real quick. I'm going to spotlight your video. There she is. And also I've got Mr. Mayor Scott Fadness. It's been quite the month and the summer, actually, with all this COVID-19 stuff. And Scott, I want to start with you because it's been a couple months now since we've had our own Fishers Health Department. And for those people that maybe were wondering or asking questions, why did you feel the need to have your own health department? Why do we have a health department now? Because we had the county taking care of us for years. Why'd you need your own?
So there's an immediate and a long-term answer to that question. The immediate answer to that was, as we started to try to understand how we could best position our community to be resilient during this pandemic and provide the best possible service to our residents. I've been reading a lot from Johns Hopkins and other institutions about what you needed to do from a public health infrastructure standpoint to be able to help your residents through these situations. And testing and contact tracing were really important, and kind of integration into your community. And so cities, second-class cities in the state of Indiana have the legal right to create a health department. And I saw a path forward that made a lot of sense for our city. And so, since the inception of our health department, thousands of residents have received testing and services at no additional cost to them. And we've been able to do contact tracing and really understand what's happening in our community. It gives us a higher level of intelligence around this communicable disease. The second part of that is, I believe long-term, that public health is going to have to be front and center in the long-term resiliency of a city. And I wanted our community to be able to integrate those services into the fabric of our community so that restaurants had a resource locally that they could talk to, that economic development could speak to our public health infrastructure, that, so much of what we're doing around mental health and a lot of the things that we were already working on, that we had a point person and the skill sets and the capabilities long-term to be able to really accomplish a really vibrant and sustainable city. And so far, I'm really excited about the progress we've made, both on the immediate issues, but also, hints at what we can do moving forward are really, really exciting. We're especially excited, I think I am personally, about the team I've assembled with Dr. Indy Lane as our Chief Medical Director, who's a stellar individual and Fishers resident. And then we're so fortunate to have Monica come on board with her background, and she can speak a little bit to just her extensive knowledge and training and background. But really, we now have the chief architects to put this in place that can really deliver value to our city long term.
So let me ask you this question, Scott, maybe as a follow-up to that. What can you do now with your own health department that you couldn't do before through the county? Are there some added benefits of having your own health department that we're seeing that maybe most people don't recognize?
Sure. So, for instance, as a city of Fishers, I would have no ability to test or provide testing for individuals. I would have no ability to do contact tracing. I would have no ability to provide guidance or policy around closing of buildings or facilities, businesses, putting face masks, all those things. Statutorily, I would have no authority over, and would be left to the devices of the greater county when issues arose. And so all of those things would not be possible had we not created a health department.
Okay, so now we've got this health department going. It seems like, Monica, you were hired to head up a huge division with a lot of responsibilities, including COVID testing, but I'm sure that's probably the 800-pound gorilla in your office these days. How is the free testing going for Fishers residents? If people didn't know, they can go to fishersrecovery.com. You can actually, you can come in through a drive-through and get tested at the old police station, or I guess it's now in the fire station area. But you can get tested for free. I've seen people driving through there. How is that going so far?
So the process itself is quite smooth. It's a pretty simple sign up process online. I did it myself a while back. And you take an assessment online that asks about your symptoms. And then after you take the assessment, you're offered the ability to schedule an appointment. So you schedule an appointment at some time that's convenient for you. Based off of our schedule, you get a QR code that when you show up at the testing site, which is the testing site is actually in the old police station building. And it's pretty clearly marked. You drive through, it's just a drive-through garage process. It takes about less than 5 minutes. They scan your QR code and then they swab each nostril and you're on your way. And then the results are delivered automatically to you by your email, a link to your results. They're automatically delivered as soon as they come in from the lab. So it's a direct connecting process. There's not a middle step that has to happen on our end to release those to you. So as soon as they're released by the lab, you get a notification that you can then go check your results. So that part is very, very smooth. I know that some of our labs had got caught up in some of the national backlog that's been happening due to all the increasing cases around the country, around the state, around the region. But we've taken measures to address some of those issues. So although we still have some results that have been outstanding for quite some time, we are now in a good place where we have a better process in place. So people are getting those results back a lot faster since we implemented those measures.
So when did you implement these measures? Was that something that happened this week sometime?
It was mid last week.
Okay. So
I think, to maybe put a fine point on that, Tom, a lot of our tests, and we had gone for several weeks where things were going very smoothly. And our tests were going to a particular lab in Chicago to provide those results. And then when the national spike occurred, where you saw Florida, Texas, a lot of these other states really just skyrocketed in terms of the number of people sick, and then they did a lot more testing. A lot of those tests ended up in the same labs that we were using. And so it just got backlogged. And so we got on the phone right away with our local lab that we're working with and said, hey, we need to remedy this. And they're taking measures now to bring a lot more of ours into their local production facility. And hopefully we'll see much quicker turnarounds. But we really just had probably about a week and a half, I would say, Monica, where there are results that just got tied up in this huge national onslaught of testing.
And of course, people will crucify you on social media for any reason, not the least of which it takes 7 to 14 days to get a test back. If somebody does, this kind of goes without saying, but Monica, just to set the record straight, if somebody does feel like they have the symptoms and they go get a test, should they just go back to work until they get the results back? I mean, what's your recommendation for folks that do feel the symptoms, and maybe not all the symptoms, they just don't feel well, and they come down and get a test to rule it out? What's your recommendation to those people?
Yeah, if you're feeling ill, you really need to continue to stay home until you have some kind of alternate diagnosis, or until you're able to get those test results back. But ideally, you want to have an alternate diagnosis that explains those results, even if your test results are negative. So the safest thing to do would be to isolate for the same amount of time that would be recommended for somebody that has confirmed positive COVID, just because the test isn't 100% definitive. So even if you're feeling sick, even if you have a negative test, it could be that you were tested too soon or just weren't shedding at that particular moment. So I don't want to scare everybody with that, but the more cautious you could be, particularly in the case when you're having any kind of symptoms that could be related to COVID, the safer it's going to be. Now, not everybody can do that. We have some critical infrastructure that has to be maintained, and so there are slightly different guidelines, but certainly if you're feeling symptomatic with symptoms that could be COVID, please stay home and isolate yourself.
Okay, so good advice. So if you do feel sick, don't wait for the test to come back to stop everything. You should stay home anyway and self-quarantine as best you can.
Absolutely.
Let's talk about the mask mandate. Everybody loves the mask, right? Everybody's all aboard with the mask. I guess it was last week. It's been a week now that the mask mandate has been in place. It was an order from the mayor. It's going to go through September 4th, which is the Friday before Labor Day. I see a lot of people that hate masks. They're flaming them out on making them wear masks, and oh my Lord, the world is caving in on me. From your perspective, though, have you seen the numbers cooperating or collaborating with what you hoped would happen if people started wearing cloth masks coming in and out of Fishers?
So, do you want to take it, Scott?
I'll just say this about, I think, Tom, the context for this is really interesting. It kind of ties all this together, in my opinion, is that by putting testing in place, and we're testing more residents than as a percentage than most communities in the country. And then between Monica and her team's work of getting all the data of all the individuals that have received at least a positive test in our city, when you go onto our dashboard, you're seeing a more comprehensive look at what's happening with this communicable disease in our city than you're going to find in just about any other city around. And Monica came to me, there it is, the dashboard, there you go. Monica came to me when this dashboard started heading the wrong way. And in particular, you look at those red lines there with the blue bars and the red lines. We started to see a fairly significant upward trend in positives. And so, by having that information, we were equipped to make the right policy decisions. And Monica and Dr. Lane presented the opportunity to discuss this at the health board, and among a group of physicians and policymakers, there was a unanimous consent that we really do need to take some steps to mitigate and bring down that bar chart. And what I think people need to understand, first and foremost, our goal is for people to really accomplish two things. One, to live life as best they can, and to do it as safely as possible. And so, we want people out in our community. We want people at restaurants. We want people out in businesses. And we want to do that for the foreseeable future. In order to do that safely, sometimes we have to take mitigation steps. And that's what this face mask conversation is all about. It's about long-term viability of our local economy and keep people safe. And I'm just grateful that we had the information and the infrastructure in place to know when to do it.
And it's going on now through September 4th is kind of the plan. Monica, what do you hope to see, I guess, what are you expecting to see between now and September 4th as it relates to the results as far as cases and all that stuff?
Well, we know that this is the easiest and least restrictive measure that we can put in place to allow people to continue going about their business. And what some of the data that we're finding shows that if we could all do this, even as a country, for a solid 6 to 8 weeks, we could really make a huge dent in our cases and really kind of get things back under control a lot faster. We can only control our own community as far as those measures go. So, I don't think it's going to have as drastic of an effect as we might see on a national level if we were all to participate in something like this, just because we're all, we travel to Indianapolis, or we travel to Noblesville, or we travel to other places that may or may not have the same measures that we have in place. But if we can all do the very best we can to try to get this thing under control, and that'll keep us open longer. We'll hopefully see decreasing trends in our cases and decreasing percent positives. That allows us to continue to go about our business instead of having to roll things back. So what you've seen, for example, recently in Indianapolis, they've recently rolled back some of the governor's measures as far as limiting capacity in bars and restaurants and things like that. So we're hoping that this simple measure will allow us to kind of stay on track rather than having to roll back any farther. But having the data available and having the resources in place to monitor all of those trends will give us the best and first look at what we need to do going forward.
Okay, so if you guys are just joining us, we're starting to get a little bit of a crowd on Facebook right now, and have some people just joining us live. They've probably missed a few minutes. If you guys are just joining us now, I'm Tom Britt with the Fishers Magazine here in the Town Post headquarters in downtown Fishers, and we're talking about the new Fishers Health Department. We just got done talking about the need for the department. We talked a little bit about the mask mandate, the testing, and what's taking so long. Why is it taking 7 to 14 days to get results? It seems like that's being remedied in the last 10 days or so. And I've got Monica Heltz with the Public Health Director of the new Fishers Health Department, also Scott Fadness, the Mayor of the City of Fishers. Monica, I want to do something kind of fun with you now, if you don't mind. We're going to do a little yes, no trivia questions about mask, okay? So I'll ask you a question.
I should have warned you about Tom, Monica. I apologize. I should have warned you about Tom before the interview.
I didn't even study.
There's always a curveball, so you always got to watch for the curveball. Well, these yes or no questions. You can't articulate anything, just yes or no, and it'll start out easy. It'll get a little bit harder as we go along. The first question is, does my dog have to wear a mask?
No.
Okay. Do I have to wear a mask while I'm exercising?
You don't have to, but I would add some caution. I know I'm not supposed to have anything but yes or no. But I would say be very cautious because exercising is a very high risk activity. So you definitely want to have spacing. You want to be outdoors if at all possible. Any of those extra measures you can put in place are going to keep you protected.
I'll take that as a no. Just take that as a no. Okay. If I work outside, do I have to wear a mask?
If you're able to be distanced from people, then no. There's a lot of caveats here.
There's always caveats to every question. If I own a business, can I refuse service to someone who's coming into my business and they're not wearing a mask? Can I tell them they can't enter my business?
Yes.
Thank you. All right. If my child is 4 years or younger, do they have to wear a mask?
No, but if they're in daycare, we recommend that they try.
There's always a no but. I like that. If I have a reason I can't wear a mask for whatever reason, do I have to carry like a permit, a letter from the governor? I have to get a license for that? Do I have to show any proof that I don't have to wear a mask?
No.
Okay. And if I've already had COVID-19, do I have to wear a mask?
Yes.
You answered all those questions correctly. We got all the yes, no questions, and even the buts and caveats were all covered. I want to kind of end this on talking about the tracing. You know, we're doing contact tracing, which it keeps talking about how important that is. Monica, how does that work? Somebody gets tested positive. How does contact tracing even work?
So when we have someone who's identified as positive, we start by calling that individual and asking a bunch of questions. But from the contact tracing perspective, we're going to ask them where they've been, starting from the 48 hours before they were tested or before their symptoms started, whichever thing happened first. And then during that time frame, which people might they have been in close contact with, which would mean that they had been within 6 feet of that person for more than 15 minutes. So that's the definition of a close contact. So we try to get as many of those individuals identified as we can, and then we start calling down those contacts. So if you get a call that you've been identified as a contact to someone, a close contact, then you'll be expected to quarantine for a solid 2 weeks, and you'll be asked to go get tested as well, and monitor your symptoms and all of those things. But it's important that those individuals who are contacts also remain in their home, remain away from others, and be quarantined. That's how we get ahead of this virus and stop the community spread. So it's really important process, and one which relies heavily on people answering those phone calls and providing the information about their contacts to us. It doesn't mean you can't also tell your own contacts, that you've exposed them. I would encourage that as well. But we need to know as well, and we're the ones that kind of can help somebody walk through the situational factors of how long they need to quarantine, and kind of give them those dates and things, and answer any questions that they might have about what that means.
So if somebody calls me and says, hey, I was exposed to COVID-19, I went and got tested yesterday, but it could be a little bit of time before I get back, what should I do?
So if you get a call that you were exposed to someone who is exposed, so that's kind of a secondhand contact, there's nothing specific you need to do except for monitor your symptoms and ask for that person to call you back and confirm if they have COVID or not. So you don't need to quarantine if you're a contact to a contact. But you should still wear your mask. You should still watch for symptoms. If you develop symptoms, you should still isolate yourself and get tested. So, I mean, that's just the same recommendations we would give to anybody in the public.
And so what do you do with somebody who's maybe working in the public, is tested for COVID, finds out later that they do have COVID, but in the meantime, they've stayed in the public domain, and it's really, you can't really identify everybody they've touched within 6 feet of them because they've been exposed to multiple people. I'll give you an example. There was a restaurant just locally here that evidently there was a person who felt the symptoms, got tested last week, kept going to work, found out yesterday or the day before that they were tested positive for COVID-19, and they work in the food service. So they've potentially exposed how many people? We don't know. How do you address things like that? Is there a way you can make maybe public announcements or do, I guess, maybe a press release or something about mass exposure versus just those isolated incidents?
Sure. So as part of that process, obviously a lot of this kind of depends on how honest people are with the contact tracing process and how much notice we actually get. But we also kind of depend on employers and schools and other organizations to give us a call if they're trying to sort through that. So ideally that individual has notified their employer. Now the employer oftentimes will call us and say, what do we do? How do we identify which staff need to go off? And so we walk them through that process, kind of assess the risk on an individual level to see whether we would advise a community notification or whether they just need to quarantine a couple of staff. Every situation is completely different. And most interactions, particularly in the food service industry, are pretty short. They're not 15 minutes of duration unless it's two other employees that they're working with, right? Your server isn't typically, for example, standing at your table for a solid 15 minutes. They may be back and forth, but they may be at different points of the table. So they may not have, we wouldn't consider everyone who had been in that restaurant to be a close contact. That doesn't mean there's no risk. So that's why we recommend wearing masks when you're not eating and drinking, having that spacing, having that extra capacity within the restaurant. So that's why, the decreased capacity levels, encouraging people to take things outdoors more. All of those are steps that kind of decrease your risk. But eliminating your risk, you can really only do if you're holed up by yourself at home.
Right.
I think one thing, Tom, that the health department offers too to our businesses, and we use it here at the city, is an assessment tool where, these employees, hopefully we're asking them every day, do you have any symptoms? And we have an algorithm that allows you, once you answer those questions, it literally tells you, hey, you should stay home, or you should, come to work. And I think, if you're a business out there in Fishers and you're wondering, well, how do I make sure that that person doesn't come to work? We do have those tools available for free that they can sign up for and have their employees go through it every day. Just ask those simple questions. It takes like 12 seconds to answer those questions, but it might screen out some of those individuals and keep them home when we need them to be home.
That's a great idea. And I guess I want to share this real quick. This is the website. It's called fishersrecovery.com. This is kind of the landing page for everything to do with COVID-19, testing, tracing, the data analytics are posted here, just about every day. They update these numbers, some videos to watch. Excuse me. That's not a COVID cough, by the way. That's just an allergy cough. But all this information is here. So I highly recommend, if you're a Fishers resident or business owner, you get familiar with that page. It's a really important resource, and it's being updated every day as these events around us change every day. Scott, I think kind of put a bow on this conversation. I'm going to ask you about this mask ordinance that was put into effect. It's supposed to end September 4th. What are you going to be looking at, September 1st timeframe? I'm sure earlier than that, but what are you going to be looking for before you lift that mandate on mask?
Well, so by having this data, we got to be able to have the courage to take mitigation measures when we need to and close things when we need to. But we also have to have the courage to know when to open things too. And both of those are as scary to a public health official either way. And so, there's going to be a lot of conversations and a lot of work with Monica and Dr. Lane. Really, my decisions will be based upon the recommendations of public health experts. And the big question we'll have to ask ourselves, if we drive that bar down, if we drive that number down, and the virus is still here, there's no vaccine yet, but we've driven that number down, and the data shows that, boy, we really have it under control. The question we have to ask ourselves, is the number down because of the things that we've done? And if it is, why do we think if we take those measures off, it'll all of a sudden just stay down? So those are all things that we're going to have to contemplate as we move forward. But the good news is that Fishers residents, when you look at that dashboard, you're seeing a very comprehensive view of what's happening in our city, and it really should guide you. And one of the things that Monica is doing now, starting this week, is every day she's providing an update, providing context to those numbers to really help people understand, what should they be thinking when they look at that bar chart. And that's something that I'm very excited about, because I think the average family, when they look at that, you can draw your own conclusions, but if you're not a public health expert, you don't know what to make of that. And I think Monica can help guide folks along the way. And that's, when we get to September, I don't think it'll be any surprise to anybody which way we go, because we'll be having this dialogue with the community all the way along.
Yeah, it's definitely an ongoing discussion, and I think the mask mandate was a little weird at first, but I think we were already kind of doing it anyway. So I think it's kind of nice to just have some guardrails put up and say, just wear it all the time if you're in public. And when you get to your table and you got 6 foot distancing, you can take your mask off. I mean, I think it's pretty easy now.
Just got to embrace the awkward, right? I mean, it's awkward. We get it. Just get over it and move on.
Yeah, and we had a question on our Facebook just now. Somebody was asking if they have a retail place. They want to know, they have like 2 visits a day in their shop right now. Do they need to wear their mask the entire day or not? I think the answer to that is no, only when there's people in the shop. Is that correct, Monica?
Yeah, if you're manning a shop by yourself and not having a lot of visitors coming in, then you can certainly remove your mask until the time someone else comes in. Okay.
Well, listen, guys, can't thank you guys enough for taking the time to spend with all of us and kind of getting us up to speed on what's happening. Again, it's fishersrecovery.com to stay in the loop on this. And, Scott and Monica, thanks for all you guys are doing. I know this is taking up a lot of time, and there's still a city to run on the other side. There's still pools that have to be tested and other things that the health department's doing besides COVID. But we appreciate you taking the time off. And again, fishersrecovery.com. I'm Tom Britt signing out. Guys, have a great weekend and stay safe out there. Don't forget to bring your mask, okay? Take care.
Thanks, Tom.
Thanks,
Thank
Tom.
you.